is Shishir, and I'm here to get a hair transplant. I've been experiencing hair loss for at least 10 to 20 years, and it's been a gradual process. And I'm here to have recovery of my hair and get the new look.
Is there anybody else in your family that has hair loss as well?
Yeah, it runs in my family. Father, brother.
And how long ago did you start losing your hair?
I think at least 10 to 20 years.
Okay. All right. And does hair loss affect you in any way as far as your image when you look at yourself in the mirror or when other people view you as? Do you think it affects?
Yeah, I think it affects the overall personality. I'm a confident kind of a person, and this thing bothers me. And I look at myself and I look at my pictures from 10, 20 years ago, and I see a big difference, and I wish that I can look closer to what I was 10 years ago.
Okay. And how did you decide on natural transplants as opposed to other places, or did you look other places?
Yeah, I did look at other places, and I've been thinking about it for almost 2 years. I just got a feeling that you are genuinely caring for the patients rather than just charging by the graft, and I'm a physician myself, so I understand what it is to present yourself in a professional way rather than in a business entrepreneur kind of a way, which really does not work in the field of medicine.
Okay, here Dr. Huebner, Natural Transplants, here with a patient today to share. So we basically drawn out his new hairline, and you can see what it's going to do. It's going to reframe his face, and we've kind of gone through the game plan, which in his case is going to be very straightforward. We're going to start from the front, reestablish that hairline with micrografts, meaning grafts that have one hairs or two hairs, so it's nice and soft and natural. No more of this doll's hair pluggy look like you may have seen in the older style transplants. We're going to start from this front portion and work our way back, and hopefully get into the crown a little bit today. I'm hoping to get at least halfway back to 2/3 of the way back on his head. If you can see, I'm going to bring him in front of the mirror here. You can kind of see the areas that we're going to do. So what I've done again, I've drawn out the crown that he has in the back. And we can see where today we're going to focus on this frontal hairline and this area, and hoping to get all this area jam-packed full of hair. And hopefully, again, we take as much hair as possible. If there's anything left over, it goes right on top of his head. We keep moving that line back and back. So hopefully we'll just have a little tiny half moon on the back of his head. Sometimes, if the density is good enough, we can fill the entire head. But what I don't want to do is sacrifice density. I don't want to spread his grafts out too far apart, because then I'll get a bunch of nothing, a bunch of little tiny stuff everywhere. We don't want that. So anyway, very excited. We'll be checking in today on his progress. Thanks for watching. Okay, I'm here with my patient Shishir, and we've just finished up his surgery. Shishir, how was the day for you?
I'm very happy with the way things went. I'm very satisfied with how the procedure went today. I came in at around 3 o'clock, and I was the only patient here. The whole staff was there. Actually, thanks a lot for rescheduling, making arrangements to accommodate me within such a short notice. And other than numbing up the area, you really don't feel the rest of the procedure. I was just watching TV, eating chips, and having juice all the time, and I'm feeling a little bit of pain now, and with the Motrin, it's gone, and I'm looking forward to the results.
Great. And most people at the end of the surgery, the anesthesia starts wearing off in the back, so they usually get some ibuprofen to leave, but oftentimes they'll need something stronger. We do tramadol. We also can do stronger narcotics like Vicodin if needed. Majority of patients don't even require the strong narcotics. So, and most of the pain is going to be tonight. It gets much better as each day goes by. So I'm going to just kind of pan up here so you can kind of see what we've done. So obviously, when you first have the surgery, everyone says, oh my gosh, I look like Frankenstein. And it's true, because all these little grafts are above the skin surface, and that's the way they're supposed to be. Now you can see where his new hairline is going to be. It's staggered up and down. So you can see how that looks, and you can see the stronger grafts behind that. Each one of those little white dots represents a graft with multiple follicles in it, sometimes 5, 6, 7 hairs. So these again cannot be in the frontal hairline, but we want to put those in the central portions of the vertex and the crown, because that's what gives you the density. we don't want to cut those down. We want to benefit from that density. So you can see how it's going to reframe his face and change his whole look, the way he used to look. And I'm going to show you the amount of coverage that we have. So in his case, even with his the loss that he has, we were able to get into the crown. He has this half moon crown left. And at a future date, we told him that he has the hair to do it if he ever wants to address the crown in the future. But we never want to do anything until we see what we have. So you want to get it, nothing's going to grow for 3 to 4 months. And then we want to grow it out. He may get coverage into the crown based on the stuff that's in front of that. So anyway, I know I've been droning on here and on, but thank you so much again, Shashir, for letting other people understand the process. And we really look forward to your results. Thanks.
Thank you.